This exclusive for My News reveals that drunk A&E patients should be fined, senior medical experts say. Let's have a look more into this, guys. Let's go. Good morning, good afternoon, good evening, guys, wherever you are in the world. This is REGANELITE here, with an exclusive from iNews. And the headline is, drunk A&E patients should be fined. Senior medics say as they reveal plans to save the NHS. So, I don't know. Should they be fined? I think so. I mean, if they're going to be, I guess if they're violent, I don't know. Right, what if they come in and they've consumed too much alcohol? Let's read into it before I say too much. Yeah, I think that should be the better thing for me to do. We do have an alcohol problem, we do tend to drink too much as a culture in the UK. That's one thing for sure. A group of healthcare leaders, policymakers and patient representatives reflect on what the NHS can and should do to adopt to remain fit for purpose. Finding patients for missing opportunities or turning up to A&E drunk, bringing staff out of retirement to update millions of people on waiting lists, and having a Bank of England style independent board to run the health service are just some of the radical ideas that can transform the NHS. Senior health figures have written in a new book out on Friday, July 28th. A Bank of England independent style board. I don't like that. Bringing staff out of retirement, yeah, good luck doing that. Finding patients for missing appointments. This is just the start of privatisation, really, isn't it? But to be fair, we were mostly privatised anyway. But that one about, an England style independent board to run the health service. Whose idea is that? It's their idea, isn't it? I'm not so sure about that. Something's a bit fishy about that. A group of healthcare leaders, policymakers and patients representatives have come together to reflect on what the NHS can and should do to adopt to remain fit for purpose. Conversations about the NHS set out the case for change chapter by chapter, and those who know it best. I've spent 40 plus years in the NHS, from training to consultants to academics, so the idea that this has been bubbling along in my mind for some time, says the book's author and editor, Professor Dinesh Bhugra. One of the things that has always intrigued me about the NHS is that its demand has been increasing over the years, but nobody has been honest about what we need to do in order to meet that demand. How do we try and educate people on self-management and self-help? Every day now we read a story about the NHS in crisis, or there is a new treatment, like we saw this week with the Alzheimer's drug, which means investigations and treatments are getting more expensive, yet nobody's prepared to stand up and say, listen, if you want all this, you need to pay more. Yeah, but just do it out of the national contribution. But I don't do it in the tax. We pay a tax into the NHS. If we got to pay more for it, we got to pay more for it. But why do we need to do? I don't. That's the if we have to pay more, then fine. But that's where it should be coming from, not coming directly out of people's savings, out of people's money, in my opinion. That's the whole point of the NHS. It's supposed to be free at the point of use. We pay a national contribution tax in order that we don't have to pay directly. Everybody pays into it. So why do we want to change that? Like, who wants to pay $2,000 or whatever for a cancer treatment down the road? Who wants to be paying out of their own pocket for healthcare just to stay alive, or to live a bit longer, or to be less ill? Who wants that? Nobody wants to do that. That's why the system was so good. The only reason the NHS is in the position that it is in is because of underfunding, the austerity that's been imposed on it over the last 13 years. That's the absolute facts. Yeah, what was happening to the NHS? None of this was happening before 2010. The NHS was the most popular thing. Was one of the best healthcare systems in the world at that time. One of the most respected. No one was saying anything bad about the NHS. No one was complaining about the NHS back then. And yet, for some reason, we think that just because of what's happened with Brexit and cost of living crisis and whatnot, and yet people still think it's doctors and nurses' faults that they can't get their appointments, or that they blame the NHS, and yet they can't see the bigger picture. Professor Bhugra, Emory's Professor of Mental Health and Cultural Division at King's College London, challenged the group on 14 on what they would do now if they had to build the NHS from scratch and make it fit for the future. Dr. Max Peckerton, a psychiatrist and journalist, said he would very much be up for charging people who would end up drunk in A&E and overwhelmed NHS resources. Yeah, I think so. I'm going to have to agree with that one. Like, you're taking up, like, if you're not looking after yourself, like, okay, there's nothing wrong with going for a night outs and all that kind of stuff, but if you're going too far and you end up in A&E, like, I'm kind of agreeing in that one. But yeah, I understand some people in the comments will say, well, that will lead down the road to charging for other things. I get that. But this charging for other people, this consistently happens, and it takes up so much time with the NHS because people don't look after themselves. I get the whole mental health side of things, but there needs to be a way to look after yourselves. He writes, it's only a very small area, but it just goes to show that people need to take more responsibility for their actions. Dr. Channa Nagpal, a GP and former chair of the BMA, calls for the creation of an independent body to run the NHS and to put the end to political pronunciation that have wasted billions, citing the 12 billion IT disaster under Tony Blair's government and as an example. He said the Bank of England's board ability to decide interest rates at arm's length from the government will serve as an aspiration to such change can happen if the political will is there. It's also about being honest with the public with an independent board would be. We don't hear politicians talking about how much 1/3 of the hospital beds in Germany has. All we hear is how much more money the government has put into the NHS. You hear political responses to problems rather than honest appraisal, Dr. Nepal says. I'm still very sceptical about that. I'm very sceptical about an independent body. An independent board would tell the public why they have difficulty accessing care, so they have realistic expectations, and they will also have better informed about how the NHS should use its resources. There is also pressure on the NHS leaders not to open about serious problems because if it doesn't fit the narrative of politicians. Politicising the NHS cascades downwards and fuels the way NHS behave. So we don't have a climate of learning, and as a result there are far too many instances of poor care and scandals that are impacting patient safety. I just think that the influence of privatisation of healthcare experts from outside America, for example, and other nations can get on this board and influence and encourage more to charge people on more options. It does sound good, but I just think this just doesn't feel right to me. It feels very, very dodgy. Dr. Sarah Hallett, a trainee paediatrician and past chair of the BMA's Junior Doctors Committee, said a health secretary should ideally be someone with the experience of working in the NHS rather than politically convenient cabinet appointment for the Prime Minister. We've all been there when health secretaries come to work and the place has been spewed up. There's new artwork on the wall and certain challenges have been hidden out of sight. I understand why people want to do that, but I don't think it necessarily means they're always a glimpse of what's really like at 3 a.m. in A&E in various parts of the country, Dr. Hallett said. They need to see the goods, and I love being a doctor and working in the NHS, but there's also significant challenges with the NHS that is so chronically underfunded and under-resourced. There's only so much you can get from being briefed that your special advisor is going on to announce visits. Having a working experience would be a significant advantage. Someone in Parliament who fits the description is Dr. Dan Poller, Tory MP for Central Suffolk and North Ipswich since 2010. Yeah, Tory MP, yeah. A psychiatrist who continued to work in mental health service and served as a parliamentary Undersecretary of State in the Department of Health between September 2012 and May 2015 when we returned to the backbenches. In the book, Dr. Poller calls for the 20-year plans for the NHS service to be better served the workforce needs, something almost trumped by the current government, which published its NHS long-term workforce plan this month, setting out how the health service will recruit an extra 300,000 healthcare professionals over the next 15 years. There is always challenge in alienating longer-term NHS organisations and workforce plans with the 5-year political cycle, Dr. Poller says. However, given the widespread political agreement exists about the importance of sustaining the NHS, the NHS plan makes sense to facilitate this kind of transformation to the community care that is needed if we are to better care for patients which for long-term conditions. I just think it just sounds good, but like I just feel like they're trying to tell us we need to privatise it without saying we need to privatise it and we need to charge people. I just feel like they're tiptoeing around it. He believes training is no longer fit for purpose and with reformed medical education, particularly at postgraduate level, making it more generalist and less specialist with greater focus on caring for parents with chronically ill and long-term conditions. For all its problems, Professor Bhugra believes the NHS will survive in some form, at least in the coming years. It's too ingrained to let it go. My fear is going down the route of density bits increasingly privatised. Well, we are private. Yeah, I still don't know. My own feeling is that there needs to be a commission of some sort which looks at all of this because the population has changed. More of us are living longer with multiple comorbidities, seeing multiple doctors with no coordination. If I had to pick one idea in my book to implement, it would be better integration across all areas of health. That's the only way you're going to make any kind of sustained change. Don't say nothing about the NHS dental care that's in crisis, that's for sure. They don't say anything about that, do they, guys? Interesting to say the least. Some interesting thoughts there. Is an independent board really the right way, like the Bank of England? I'm still sceptical about it because the question is, it's like, okay, well, who you put on this board? How they get appointed on this board as well? Like, is it just a case of you get the greatest experts, the greatest minds on the world? Do the public have a say on who should be on this board as well? You know, that's the kind of thing questions that should be asked. Now, how do we know politicians don't get that say? You know, so there's a lot of ways of thinking about that if they do it. I'm still very sceptical of it, given everything. But I think drunk A&E patients, you know, that's when I said them obviously that they should be fined. I think if you know, I think maybe now, maybe in hindsight, maybe thinking perhaps if it's a reoccurrence of the same patients, then yes, I think it should be. If the same people keep turning up and getting drunk, then perhaps fines should be issued. Perhaps. It's a tough one. It's a tough one because we do want the NHS saved, and we don't want go down the route of privatisation. But yes, there has to be some kind of reform. But I just think it was working fine as it was. Yes, okay, our population has increased. Yes, I understand that. But Brexit, austerity are two massive factors and COVID-19 obviously, which we've made it on the other side of it, but those two have had significant impact and damage on our national healthcare service, and they're big issues that we need to address to help us get towards where we want for our national healthcare service. But what do you guys think of this analysis? What do you guys think of the book? Do you think an independent body should be something we should do? Do you think drunk A&E patients should get fined? Let me know some of your thoughts about some of the analysis there in this. Thank you guys very much for watching. Like, share and subscribe, and I will catch you all very, very soon.